Good evening, and I hope you had a great Friday. I know it's late on a Friday evening, but welcome to our second episode of Detox Me Now. And tonight's going to be a short show. We won't have any guests on tonight. I was going through our new website with one of our wellness clients, and we were going through the section that talked about detox. And so it talked about detoxification and how to detox and so on and so forth. And he said something interesting to me. He said that, Doc, he said, when I first took your class years ago, I went in and I heard all this about detox and said, well, what is detox? And so he pointed out to me the fact that I overlooked the whole idea of the obvious thing that a lot of people don't know what detox is. And so what I want to do tonight is I want to just give a brief little discussion on the whole concept of detox. And it's going to be a short show tonight, but I want to break it up in two parts. And this is more designed to be instructional. So of course, all of you who are there, I want you to like and subscribe. If you haven't subscribed, hit the notification button so you'll get more information about talks like this. But I think it's important for us to understand concepts so that if we understand a concept, we essentially own it. And so detox is a term that lots of people talk about, lots of people mention. And I hear it a lot from patients and wellness clients and even friends say, yeah, I need to detox. But what does it mean to detox? And so what I want to do is I want to cover that concept with you. So part one is going to cover, what does it mean to detox? So, this whole concept of detoxification is one that's very important. It's important for our health. It's also important for our health maintenance, as well as our overall lifestyle change and maintenance over time. So let's look at detox. Part one, we're going to talk about the meaning of detox. So what is detox? Well, first of all, detox is an abbreviation for the word detoxification. And so when we're talking about detox, we're really talking about detoxification. Now, you can probably imagine that the word de and then tox means that you're removing something from. And so if you are able to put together the prefixes and all, you understand that detoxification is a process of removing toxins. So it seems simple, when you know the answer, when you think about it, but lots of people throw the term around and say, okay, detox, but what does that mean? But, removing toxins, that's a simple statement, but exactly what does that mean and how do you go about doing it? So we want to get into that a little bit more, but the whole thing of detox is simply removing toxins. It's as simple as that, and it's important to understand that term. Now, detox for the body is what we're going to focus on. You can detox lots of things. You remove toxins from your automobile or remove toxins from, you have a chemical spill, toxic chemical spill. You have to remove toxins from, say, the streets or an environment or a building. So detoxification can apply to removing toxins from anything, but we're going to focus on removing toxins from the body. So when we say detox, we're going to automatically mean detox the body. And so in essence, we're going to talk about removing toxins from the body. So we're going to talk about removing toxins from the body. Well, where do toxins come from? It's like, I'm not drinking turpentine every day or cyanide or whatever the case is. So how do I get toxins in my body? Well, there are a number of ways. Toxins are known as free radicals, and I'll talk about that a little bit more. And these free radicals are unstable molecules. So in essence, we get toxins in the body, or they exist in the body in the form of what's called free radicals. They move throughout the cells, they cause damage, and they originate from a lot of different sources. Our polluted environment, pollution in the air, smog, other things. If you notice you're in a polluted environment, if you have asthma, you may cough, you may have certain allergic reactions, if you will, to toxins. The body tries to get rid of toxins from the environment. A poor diet, we talk about that a lot here, and we're going to talk about it more as we go through the detox program. And I probably should have poor diet kind of bold and italics, because that's probably the most efficient way we consume toxins in our everyday life in the Western environment. Prescription drugs, they have side effects. They have toxic effects on the body. They have an adverse impact on the liver or kidney or our muscles or whatever the case may be. So prescription drugs is another way that we consume toxins. Recreational habits, those of us who like to smoke or drink, alcohol, any amount of alcohol can be toxic, but those who drink alcohol on a regular basis or consume a lot of alcohol on a regular basis, again, accumulates a net amount of toxin. Of course, illicit drugs about. But we won't talk about this a lot in this show, but down the road, I threw in emotional trauma because it represents an area by which we bring in toxic things from our environment, such as, emotional stress. If we're around people that are negative people, or if we're in stressful situations, stressful work environment, these things can have a toxic impact on us. Watching TV too much, you're getting a lot of negative input from the news. It's talking about negative news all the time. This can have a toxic effect. Lots of people, our patients, are sitting around watching the news about, the pandemic and, all of the deaths and the like. And so people are worried. They're sitting in their house and they're worried. So that has a toxic effect on the body. So there are emotional ways that we can bring in toxins, and it can have adverse biochemical effects. And so I threw that component in there, just kind of balance the discussion out. But we're really going to focus on, the biochemical toxins, the things that we consume, and more specifically food over time. So as we alluded to earlier, free radicals are toxins. There's a major form of toxin. There are probably many other toxins that exist in the human body. Free radicals are commonly identified toxins. They're pretty well known. And so we're going to focus on free radicals. And in this image here, you see an apple, looks nice, green, Granny Smith apple. But over time, as we've seen, fruit like an apple can oxidize over time. And so the oxidation of an apple, as you can see, it becomes, discolored and it rots away. Well, that's an oxidative process. Free radicals over time build up in this apple and it breaks it down. Here's a little picture of a normal cell. This cell gets attacked by free radicals inside the body, and these free radicals lead to a destruction of the cell. And you have this phrase here called oxidative stress. We're not going to talk about oxidative stress a lot in tonight's discussion, but we will talk about oxidative stress later on as we discuss different patients that we're treating and things in this program. But oxidative stress in the context of breakdown is really an imbalance. You have more free radicals than you have antioxidants. Antioxidants balance out free radicals by stabilizing them. So you have an excess amount of free radicals, too many for the antioxidants to stabilize. Then you have an oxidative stress situation where you have these free radicals roaming around, causing lots of damage. So this whole concept of toxins, you get an excess amount of toxins. So these molecules are floating around, causing damage to cells, pretty much like this diagram shows. Now, toxins can also contribute to inflammation, and lots of people understand what inflammation is. I like to liken inflammation to a biochemical fire. It's like increased smoldering fire. Your body's immune system is revved up, and these immune cells, which are designed to hunt down and kill bacteria and viruses, they're designed to cause damage, but they're designed to cause damage to foreign invaders, not to your native cells. However, if you have a lot of free radicals, which behave like foreign molecules and cause damage to your normal cells, it causes the inflammatory cells to be triggered, and they're alerted, and they go around, they try to clean things up by destroying damaged cells. And so by doing that, it creates an inflammatory process that's there that wouldn't otherwise be there, because if you didn't have the toxins causing damage, you wouldn't have to have the need for these inflammatory cells causing a fire. And inflammatory cells have free radicals in them also because they use free radicals to damage other cells, such as bacteria, viruses, which are not cells, but other foreign invaders, if you will, parasites or the like. So inflammatory cells do a good job or design rather to protect you, but in the setting of free radical, which causes somewhat of false alarm, it damages your normal cells, the inflammatory cells come and they cause more damage by having to clean up these damaged normal cells. So inflammation is equal to a biochemical fire. If you have chronic inflammation, it's similar to a slow kindling fire. And so that's chronic inflammation. So let's say, for instance, someone has a chronic illness like diabetes or high blood pressure or high cholesterol. They have a chronic smoldering inflammatory condition. And the signs of that is their chronic illness. The signs of that could be the diabetes, because the diabetes is associated with insulin resistance. We know that insulin resistance is due to the fact that the cells do not take up glucose normally. And the reason for that is that these cells are not functioning normal. Why are they not functioning normal? Because there's an underlying inflammatory process that's suppressing their ability to function normally. So this chronic inflammation is a slow kindling fire. Now, if you ever barbecued before and you get your coals, you kind of, put the lighter fluid on them, you start the fire, you get the coals hot, the coals have a kindling fire. So there's a little bit of smoke rising. And so that's like chronic inflammation, kindling coals on a fire pit, on a barbecue pit rather, that's smoldering in the normal process. However, if you take those coals and you take some lighter fluid and you spray it on the coals that are kindling and smoldering, then you'll get a flare-up, a large flame will come up. And so that flare-up is an acute flare-up of the slow kindling fire. Well, an acute inflammatory situation, so acute inflammation is like a large flare-up of an acute illness. So let's say someone has chronic coronary artery disease, slow kindling fire in the coronary arteries, you develop plaque, cholesterol's up, C-reactive proteins up, you got slow kindling fire in your coronary arteries. But then all of a sudden something comes and triggers. What could trigger inflammation, a flare-up? Well, anything, an infection, a toothache, a viral infection, coronavirus, some other type of event, a surgical procedure where someone does an incision, the surgeon makes an incision, that can cause inflammation. It can cause acute flare-up of your coronary arteries. So if the coronary arteries flare up, you can have a plaque that ruptures and it can cause a heart attack. So a slow inflammatory process can become flared up and cause an acute illness, an acute process, an acute illness such as a heart attack, acute illness such as rheumatoid arthritis, arthritic flare-up, acute illness such as chronic obstructive pulmonary disease. So here's a situation where you have smoldering process and it can be acutely flared up. How do we get rid of these free radicals? In other words, in essence, what's the biochemical mechanism by which we get rid of toxins? Well, simple. Antioxidants are molecules that have an extra electron. Earlier we said free radicals are unstable molecules. And the reason they're unstable is because they float around and they lack an electron. And so they have a positive charge, they float around, they cause damage. Well, guess what? If you have an antioxidant or enough antioxidants around, they can donate an electron to these free radicals and stabilize them. So make them into a normal molecule. And so therefore they become stable and you in essence get rid of the free radical that causes damage. So that's a mechanism. So what are sources of free radicals? Well, plant-based foods, leafy green vegetables are antioxidants. Excuse me. What are sources of antioxidants? Leafy green vegetables, antioxidants. But there are other things that are good source of antioxidants, such as fresh air. Exercise can have an antioxidant effect. There's some complex mechanisms by which this can happen. But one thing we have our clients and patients do is get outdoors and get in touch with the earth. earthing or grounding is a mechanism by which you can have it has an antioxidant effect. The earth has unlimited electrons, and so if you're walking barefoot on the ground, the body is grounded and you're receiving electrons from the earth, and it actually goes throughout the body and to some extent helps stabilize these free radicals. So it has an antioxidant effect in that regard. So in summary, detox means that you remove free radicals, you decrease the damage that's happening in your body, and in many cases, you can reverse some of these adverse problems, such as high blood pressure, diabetes, and the like, by just simply putting out the fire. So by detoxing, you remove free radicals, you put out this chronic biochemical fire, and you improve your overall health. So in summary, detox is equal to a better you. So what I want to do in the next part, I want to show you some evidence of what we've seen with detox in our patients. I think you're going to like this data that we're going to share with you next. So stay tuned for the next segment. We're going to talk about how detox work, and I want to look at some of the evidence with you. Okay, so as I said earlier, we talked about the whole concept of detox. Detox is essentially removing toxins, and what are toxins? They're free radicals, and we remove these free radicals by essentially stabilizing them. And one thing I didn't mention is that the number one step in detox is to not tox. So you want to remove free radicals, but as I mentioned, you bring in these toxins by toxic substances, bad food, smoking, this type of thing. You also want to remove toxins not only by stabilizing the free radicals that are within inside your body, but you want to stop, consuming the things that cause the free radicals to start with. So you want to change your diet. You want to stop smoking if you smoke. You want to stop drinking if you drink too much. You want to try to minimize the prescription medications you're on to the extent you can, and remove remove yourself from stressful environments as much as you can. So the first step in detox is to not tox. And so I want to emphasize that first and foremost. So this next section, I'm just going to spend a couple of minutes, and I just want to share with you some of the clinical evidence. We at the Montgomery Heart and Wellness Center, we see, thousands of patients a year, and we see lots of people coming in with all sorts of chronic illnesses, and we work with them to try to remove these free radicals from the system to improve their overall health. And so I want to show you some of the evidence that we've published in the medical literature to show the real science that's behind this. So let's look at the first slide here. And I want to look at what we found when we applied this detox principle to patients or individuals with heart failure. Now, I don't want to get too technical, but this is a graph here that shows 4 different parameters. Now, when we evaluate somebody with when we evaluate someone's heart function, we do an ultrasound of the heart, and there are other ways of measuring this, but an ultrasound of the heart called an echocardiogram is one way to measure what's called the ejection fraction. The ejection fraction is the percentage of blood, or the fraction of blood that's ejected from the heart with each beat. So let's say, and we really look at the left ventricle is the main chamber that we measure the ejection fraction from. We can do it in the right ventricle as well, but if someone says your ejection fraction is blank, they're likely talking about the left ventricle. So anyway, if we look at the left ventricle, we'll see the heart contracting, and we can measure the volume, or indirectly measure the volume in diastole, and also in systole. And that difference gives us a fraction from this amount of volume to this amount of volume. We can calculate the amount that's been injected from the heart muscle. And a normal ejection fraction is somewhere around 55, let's say at least 50, but 55%. So greater than half the amount of blood is ejected from the heart, from the left ventricle, with each heartbeat or each contraction. The other thing we try to measure is how heavy the heart is, or how much heart mass. If someone has high blood pressure, they have a thickened heart muscle, And so they may have an increased heart mass. You don't want to have a heart that's too big. It's too big and it causes other problems such as ischemia and the like. And so increased LV mass can be a problem. That's called enlargement of the heart. Typically, we see it with diabetes or high blood pressure or the like. So if you have an increased heart mass, you want to try to decrease what I'll call regression. We're going to talk about the findings there. Stroke volume is the volume of blood that the heart contracts with each beat. And so that's the amount of circulation. It indirectly connects to the amount of circulation that you have. And the last thing is cardiac output. That's the total body circulation. So these are 4 parameters that we measure to look at heart function. The increase, the higher the cardiac output, the better. The higher the stroke volume, the better. The higher the ejection fraction, the better. The lower the LV mass, the better, because we don't want the heart to be too big and too heavy. So what did we find in individuals who came to our clinic who had high blood pressure and some had diabetes, and we measured their heart function? We did a case series of 3 individuals who had congestive heart failure. And we applied a detox principle to them. And over 78 days, we looked at the changes in their hearts. And what we found is that on average, these 3 individuals had a low ejection fraction. They were in congestive heart failure, and the ejection fraction was around about 22%. When we applied the detox to them, and we've over about 78 days, we saw the ejection fraction on average went from 22% to about 44%, with pretty impressive improvement in the overall performance of the heart. What happened to the LV mass? Now, as I said before, an increased LV mass is associated with increased heart size or cardiomegaly or enlargement of the heart. It's not a good thing. We saw that the LV mass decreased significantly from a little over 200 grams to about 170 grams. So a very significant decrease in the heart size. Stroke volume, again, a better stroke volume is better. The stroke volume went from about 50 cc's to about 75 cc's. And so that's a very significant stroke volume increase, which is an improvement. And last but not least, the cardiac output also increased to a certain amount. Not quite significant difference, but trended almost significant difference. So there was a trend toward an improvement in the overall circulation in the body. So in summary, detox for the heart meant that the heart got smaller and stronger, and that's a good thing. And so detoxification, as we saw in our case series here, was one where we saw the hearts get stronger. So, oftentimes people talk about, I want to detox just to lose a few pounds or the like, but it's more than just weight loss. The body is working to improve. And Sonia says, did I say 78 days? Yes, 78 days was the duration, not 7 or 8 years, but 78 days. And so it's really a powerful tool that you can see. Faye Parker, this is a beautiful explanation of the process of detoxification that's much needed for those of us who participate in routine detoxing. You're welcome. Thanks for the comment. And so we see this with heart failure, but what about some other conditions? How about blocked arteries? Well, this has been shown by other physicians. I'm going to show you one example here, an individual we had who came, a young lady who had significant coronary disease and angina, and she really wanted to lose weight. She saw a gastric bypass surgeon a while prior to seeing us, and she had an abnormal EKG, was sent to us because of that, and we evaluated her, and again, she had chest pain that woke her up from sleep. We did an echocardiogram. She had a weak heart as well. She was part of that other series, but she had to go to the cath lab because of her symptoms. And I did an angiogram, and this is my catheter here. You can see this and the same catheter there. And here you see this pinched in area. And this is like about a 90 to 95% stenosis or blockage, if you will. So she had a very significant lead. Now, this vessel here is called the LAD, or the left anterior descending. It feeds about 75% of the left ventricle, which is the workhorse ventricle of the heart. And then you have the circumflex, and then this is the left main. The problem with the narrowing being here, even though it's one vessel and theoretically you can put a stent, If you try to put a stent here, you would back up plaque into this vessel here, and you probably could kill the patient. So that would be a pretty risky procedure to try to stent it here. This lesion is called a widowmaker. In this case, it would have been a widower maker because she's a female. But the issue is that this is a very dangerous lesion. We offered single vessel bypass, and the thing you would do is you bring a lima down to, internal mammary lima down to this LED and bypass this to create safe flow beyond the stenosis. However, we had already talked to her about our detox program prior to getting a heart cath, and so she didn't want to have surgery. She declined surgery. She said, "Look, I want to try this, lifestyle change," and we worked with her. We worked with her very aggressively, detoxed her. In about 5.5 months, this 95% narrowing went to just about 0. And so, and this just with detox, you can tell this vessel is also bigger. So vessels got bigger throughout. And I know it's hard. You guys aren't experts in reading angiograms, but understand this clearly opened up and this vessel is bigger. So detox for blocked arteries work. Again, not just for weight loss. And by the way, she did lose 30 pounds. But I mean, when you see a widower maker, you're not so much worried about the cosmetics of how you look. You worry more about, can this artery open up? And so the power of detox, the things I talked about, removing inflammation, oxidative stress, all those things you talked about in part 1 comes into play here, because this plaque is likely an inflammatory, maybe a pus pocket. And so when she detoxed, the inflammation went down, free radicals were removed, and this artery opened up. So detox worked very well for blocked arteries. Well, how can it work for people with chronic illness? And now this is a busy slide. I'm going to walk you through this. Oh, no. Why didn't y'all tell me I didn't have my slides up? All right, let me go through this real quick. I was talking through these slides, and you guys were just listening to me in the chat room. And let me go through this again. So heart failure. These are my slides here. I didn't have my slides up. I'm talking you through this, but the ejection fraction improved. So you may have heard me say earlier, the ejection fraction improved. The LV mass went down with this graph. The stroke volume improved and cardiac output improved. So as I said in summary, the heart got smaller and stronger. And so these graphs show that. So a picture's worth 1,000 words. So I shared 1,000 words. Now you have the picture, so you got 2,000 words. The blocked artery, as I was talking about before, this patient came in with chest pain, and we did the heart cath. And here I did my cath, and the angiogram showed this pinched in area right here. That's about a 95% narrowing of this artery. That's an LAD. It's called the left anterior descending artery. So this pinched in area is a blocked artery. And so she went to a detox area. Now, as I said before, we offered bypass. We could have bypassed this vessel here, but she wanted to go through the detox. She didn't want to have surgery. So we went through the detox, and in about 5.5 months, this artery opened up. And so you see this pinched in area here, and see here, it's not pinched in anymore. And that's all with a nutritional detox. So the power of detox shows that we can open up arteries. So this is an important factor here. Let's see, Doctor. So here's a question here. Dr. Bax, is there a number that I can call for detox information? Yes. Let me give you an office number, and I'm also going to give you the 713. We actually have a online boot camp, which is a detox program. Also, we will be releasing, let me see, I'm going to put this in the chat. Let's see, call this number or go to online.montgomeryheart.com. So I'm going to give you this information in the chat. And I'm also going to create a little ticker. Let's see here. I'm going to create a banner. And so that number will be there. So that's information about the detox. We have an online course that teaches you how to detox. And when we release our digital healthy lifestyle program, we can also give you information about that. But anyway, so this artery opened up with just a simple nutritional detox. Went from about a 90 to 95% stenosis to almost nothing. So again, the power of detox on blocked arteries is pretty well known. Now, this slide is pretty busy. What I'm going to do is I'm going to maximize my screen here. So hold on. And so I'm going to point you through here. So these are individuals who came in with who are overweight, who had they had an average BMI of about 37.5. And they had hypertension and high cholesterol. And what we're looking at here are the baseline measurements. So their weight is about 108.1 kilograms, BMI 37.5, waist circumference about 111, almost 112 centimeters, systolic blood pressure, diastolic blood pressure, you see there. They were on about 1.6 medication. Remember, we said that medications can be a source of toxins, and so because of side effects. So it's important to know how many medications you're taking. Heart rate was here. Other prescription drugs about 1, and total medication about 2.6. So what did we see? Well, we saw as we went on a 4-week detox, baseline blood pressure went down, weight went down significantly here. BMI, waist circumference went down, systolic, diastolic blood pressure. All of these, you see the little B here, all of these were significant changes from the previous week. And so you see from week 1, from baseline week 1, there was a significant reduction in weight, significant reduction in blood pressure, BMI, and the like. To week 2, a significant change from week 2 to week 1. So again, a significant change throughout these top 3 parameters, not so much in systolic blood pressure because it had dropped quite a bit. Then you go to week 3, we still see significant weight reduction. Blood pressure continues. Blood pressure actually went up a little bit, but then eventually came down. But the overall blood pressure was decreased from baseline. So we saw a significant reduction in weight, significant reduction in blood pressure, and the biggest drop in blood pressure was within that first week. So on a detox, you can get an immediate drop in blood pressure within a week, and notice what happened to the medications. So they started with on average of 1.6 medications, went down to an average of 1 medication for blood pressure. Now, if you look at the total medication, other prescription drugs went from 1 to half. So other non-blood pressure prescriptions went to half. So it could have been cholesterol medicines or diabetes medicines or whatever. And the total medication number went from 2.6 to 1.6. And so we saw a significant reduction in the number of blood pressure, or the number of medications total, and especially the number of blood pressure medications, while at the same time we saw parameters like blood pressure and weight go down. So again, detox for chronic illness, it works and it's very effective. And the last slide I want to show you is detox for chronic illness again. But we looked at blood tests, biomarkers. And so we looked at cholesterol, including total cholesterol, LDL, HDL. We looked at insulin resistance. The one I'm going to emphasize would be the total cholesterol and LDL, but also I'm going to talk about hemoglobin A1C. And we're also going to talk about C-reactive protein, which is an inflammatory marker. And we saw that goes down too. So let's go through these. Again, so these parameters we did at baseline and after 4 weeks. We didn't do them every week. We didn't draw blood every week. So baseline and final. So the baseline total cholesterol on average was 216, and that average went down to 182. This p-value, if it's less than 0.05, that means it's a significant difference. And we see here there's clearly a significant change in the total cholesterol. Look at the LDL cholesterol, 143 to 118. Again, a very significant difference. Now remember, this is the same group of patients that we looked at before with the blood pressure and weight reduction. And this group of people had a reduction in their medications. And so that's clearly something that we saw there. So Sonia wants to know, when detoxing, is it okay to exercise? Yes, it is. It depends on how aggressive the detox is. If I'm leading a group of people on the juice feast, and many of you may have seen last week's show, and sorry, I misposted. I posted it on the wrong day, and many people didn't get the notification. But last week I had a group of individuals that I'm leading on a juice feast detox, and we talked about our first week, and we're going to come back on with that group probably in a few weeks, when we get closer to 30 days and get the experience. We talked about the first week being pretty rough in terms of exercising. So there's no absolute contraindication to exercise in the first week. You just want to make sure that you recognize that in the early part of a detox, you may feel more fatigued. Your energy level may not be up because the energy that it takes to detox can really take a lot of energy out of you. Sleep cycles sometimes get thrown around. So that first 1 to 2 weeks can, you might not be as energetic. And so, yes, exercise, kind of take it in stride, but you can. There's no absolute contraindication to exercising. So triglyceride levels, again, almost changed. It trended toward normal. The triglyceride levels decreased significantly. The insulin levels went down. The thing about insulin measurements is that if your body is producing a lot of insulin, that's a sign of insulin resistance, because it's a sign that your pancreas is having to produce more insulin to control the blood sugar. And so this population of people were not diabetics. And what I mean by that, when we created the inclusion criteria were people that had an increased BMI, who were hypertensive, and who had high cholesterol levels. Those were the criteria. So you didn't have to be a diabetic. Now, some people may have been diabetics, but you didn't have to be. That's important, because the fact that we did not target diabetics means that this is not a quote-unquote diabetic population. However, some diabetics were there. But so we did see a significant amount of insulin resistance, and we saw a significant change in that insulin level over 4 weeks. So that was an important finding there. Glucose on average from 90, it went down to 87. Was not a significant change in the glucose, fasting glucose. Now that's an important thing to remember, because this next parameter I'm going to show you is probably going to be shocking. And it actually can be explained by what we saw earlier. So the hemoglobin A1C, as many of you may know, if you're diabetics, diabetics, the hemoglobin A1C is the average glucose over 3 months. And so what doctors look at, because people may not reliably check their blood sugars throughout the day, so they can look at a hemoglobin A1C and get some estimate as to what the average blood sugar is. So we saw an average hemoglobin A1C of 5.9. So even though this population of people were not diabetics, we didn't screen for diabetics, on average, you can arguably say that they were in the pre-diabetic category. Greater than 5.6, say 5.7 or higher, get you in the pre-diabetic category, up until about 6.5 is frank diabetes. And so they were 5.9. So not super high, but still, there. What we saw in just 1 month, now remember, hemoglobin A1C is average blood sugar over 3 months, roughly. In 1 month, we saw a drop in hemoglobin A1C of 5.9 to 5.7. That's a negative 0.2, a significant difference on the p-value. Remember, I said a p-value of less than 0.05. This is 0.002, which is less than 0.05. That's a significant change in p-value. So we saw a significant drop in hemoglobin A1C in just 4 weeks. Now you say, well, why is that? It's a measure of average over 3 months. Why can you see a change in 1 month? Well, there's another thing that contributes to hemoglobin A1C. One thing I said was the average blood sugar over time, over 3 months, but also the fluctuations in blood sugars can also could have an impact on hemoglobin A1C. So, for instance, if you have average blood sugar is maybe about 150, but you're having wide swings, you may go up to 210 and down to 75 and then 210. So if you're having wide swings around that 150, the 150 is one level that'll impact the hemoglobin A1C, but then those wide swings will then cause an increase in the hemoglobin A1C. So my theory is that what we saw here, the decrease in hemoglobin A1C, was due to the fact that we decreased the amount of wide swings in the blood sugars throughout the day. What I think was happening, and we're going to show this in future studies that we do, is I think the postprandial increase in blood sugar was probably decreased because when you're on a detox diet, and our detox diet was an antioxidant-rich plant-based diet, and it was minimally processed. So it wasn't just a vegan diet that consisted of a lot of things, microwave food and processed food, and oil cooked food. This consisted minimally processed. We have a food classification system that we use. I won't go into the details of that later on. I'll talk about that in another show. But we controlled how the food was prepared. And so I think the swings in the blood sugars were much lower, and therefore the hemoglobin A1C went down. Very important finding here. I don't think it was ever shown in the medical literature prior to our publishing this. We had another finding of a reduction of lipoprotein A that we were first to show in the medical literature. C-reactive protein is a measure of inflammation. We saw a significant drop in inflammation, roughly 30%, which we've seen for years in our patient studies, and that was a significant change. So detox for chronic illness, we see how you can reduce medication. We see how you can reduce your blood pressure. We see how you can reduce your waist circumference, weight. And the mechanism we see at the biochemical levels, cholesterol comes down, inflammation comes down. All of these things are at work. So, if you detox the right way, with a medically supervised approach in the fashion that we recommend at Montgomery Heart and Wellness, you can see very significant changes. And we do see these changes maintained over a long period of time when our patients maintain a healthy, antioxidant-rich diet, low toxin consumption, and also individuals with more severe illness do intermittent detoxes with raw food, maintaining a healthy diet in between detox. So detox can have a very, very important role. And I'll do future talks on how to use detox on an ongoing basis, the mechanism of detoxification, some strategies in terms of how to use detoxification. But what I want to do today is give you the basic definition of detoxification. In summary, detoxification is the removal of toxins. Detox equals detoxification, which equals removal of toxins from the body primarily. And when you detox, you decrease free radicals, which cause oxidative stress, which contribute to inflammation. All of these things break you down. So in summary, detox is equivalent to a healthier you and therefore a better you. And I've shown you some evidence behind that. So I hope that was helpful to you. And thanks to the few of you who were on a late Friday night. And I know this isn't the best time to do a live stream show. Friday evening, people want to chill. It's not the best time, but it happens to be the best time for me. And I'm hoping that individuals, we won't expect a lot of people to be on live, but those of you are, thank you for your support. And thanks for those great questions. Sonia Anderson, you were great. And Catherine Welch, you were great for coming on. And Faye Parker, also thank you for coming on and contributing. And everybody else who's on live, I hope you got something out of this. You can really support the show by, of course, subscribing. If you haven't subscribed, hit the like button. That helps us out in terms of getting this show out. And please share this. Send this to your friends, family, loved ones, hate ones. Have them look at this. And if they get something out of this, we want them to like and subscribe too. So thank you for your time. It's late Friday night. I want to, next week, we will talk about some other aspects of detox. I haven't come up with that topic yet, but I want it to be, it will be something good and something insightful. So until next time. Oh, also, don't forget, many of you probably already know, Monday evenings, Fresh Natural Live, I'll be talking about the benefits of vitamin C. So I look to see you Monday evening and hopefully next week. So Until next time, keep it on the detox level and also keep it fresh, natural, and live.